Right now. A trip to the hospital is hard enough, but for some, going home after a hospital stay can be stressful in another way. One program working to support patients after they're discharged.
As the Delta variant of
that somebody cares.
And a new program at IU Health is working to help patients continue to get well after returning home from the hospital.
Yet, a social isolation can play a major role in your health. And leaders with IU Health say right now, 1 in 5 patients who come in for primary care visits report feeling isolated.
WRTV's Megan St. Torm takes a closer look at how the program works and the impact it is having on those who need continued help after being in the hospital.
Every week, Gladys, Tandy looks forward to a phone call.
Amanda calls and checks on me to find out if I need anything.
It's the highlight of her week and a big part of her recovery after returning home from 2 major medical procedures at IU Health.
I've been a patient twice. First, as a cancer patient, and I had to get stents put in.
All of this happening during the pandemic and while working as a caregiver for her brother.
I don't know if they could see that shortly after myself having a procedure, that I was overwhelmed, or I don't know. It was something because they sent the social worker in, and rather than be all proud and prideful, I just told the truth. I just said that I'm a little overwhelmed.
It's a feeling many patients experience when they return home from the hospital.
People come here to the hospital, to get treatment in an acute setting. But to get well, that all happens at home.
That's where IU Health's Congregation Care Network comes in. Trained volunteers from partner faith-based organizations pick up the phone and spend 1 hour a week talking to patients who have returned home.
The connectors who are in the program are checking in on them. Do you have food? Do you have transportation for your follow-up appointment? So with that, we are able to close some of those social gaps that may exist with some of our patients.
Making sure basic needs are met, helping them find ways to connect with their community, and sometimes just providing a listening ear.
A lot of them are lonely. Some of them have experienced a recent loss, and they just feel alone. They feel disconnected. So just having somebody there that they can talk to and they can trust and know that the conversation is not going any further, that seems to really have an impact on them.
Amanda Oliver is one of those volunteers. She's the voice on the other end of Gladys's phone calls.
Maybe it's a little selfish, but I feel good once I know that I brightened someone else's day.
We thought that we would have difficulty explaining social isolation to people when this program started, and then COVID hit. And we all understood how social isolation impacts our health.
The program has been around for a little more than a year, and so far more than 230 patients have signed up.
People need to know that somebody cares.
And that has made Gladys feel like herself again.
I laugh more, I'm more energetic.
All from a weekly call and feeling connected to someone who cares.
And since I've had help and talking to Amanda, it's like I've let go of a lot of pressure and stress, and I'm really good.
Working for you, Megan St. Torm, WRTV.
The Congregation Care Network is designed to provide patients with an hour-long phone call each week. It lasts for 6 weeks and it is free. At this point, there is one limitation. It is only available to people over the age of 60. Program leaders say one way they track the progress of patients is by having them respond to the De Jong Loneliness Scale. So far, about 35% of patients who completed the program reported an improvement on that scale, which means they felt less lonely.